Hello folks and welcome back to the C Morning Show. Now we are set for our first talk show of the day.
Yes.
And this is about health.
Okay.
Right? So we will talk about considerably a serious heart-related disease. So Shafira, have you heard about sudden cardiac arrest? What do you know about a sudden cardiac arrest?
So if you are talking about sudden heart disease, something related to that, I think yes, not with me personally, but my father passed away from he passed away sudden death, but the hospital claimed as a heart attack. I don't know, is it similar or different? I don't know.
So I am not the expert here,
Yes.
Shafira. So that is why there are still many who are confused, including us right here in the studio, about the difference between a heart attack and a cardiac arrest.
Yeah.
Although both are serious conditions, they are different in terms of type, treatment method, and also symptoms. And now to find out more, let's welcome Premier Bintaro Hospital cardiologist, Dr. Beny Hartono. Good morning, doctor.
Good morning, doctor.
Good morning.
Welcome to our studio. Thank you so much for your time.
Thank you for inviting me here.
Yes. So, Dr. Beny, yes, this is very, I don't really feel familiar with the cardiac arrest because I thought that Rafi asked me about, is it similar with the heart attack or heart disease, something related to that? So basically, doctor, can you explain what is sudden cardiac arrest?
Okay, so this morning topic is a bit horror. Sudden
But I
cardiac
think we need
arrest.
to know.
Yes,
A
of
lot
course,
of
of
people
course.
need to know.
And sudden cardiac arrest is by terminology, we say is a sudden cessation or shutdown of the cardiac activities. Basically because of the electrical disorder, and that will cause the loss of consciousness, no breathing, and loss of pulse. So everything is shut down. So without the immediate treatment, the sudden cardiac arrest will lead to person to death.
Right away.
Yeah, so very horror.
Oh, okay. So what's the difference between a heart attack and a cardiac arrest?
Okay, there's substantial difference between that. Heart attack is a condition that happens suddenly because of the obstruction of the coronary artery that supply the blood to our heart.
Okay.
So because of the obstruction, the patient will feel chest pain, chest discomfort, sometimes can fainting, have a heavy diaphoresis, cold sweat, and it will cause the death of the cardiac muscle. But the heart is still pumping. Still pumping, but decreased volume of pumping.
The supply of the blood and also the circulation as well. Okay.
So heart attack can lead to cardiac arrest. About 25% of patients with heart attack within 2 hours, will have a sudden cardiac arrest if he don't seek immediate treatment. However, for sudden cardiac arrest, it's more horrible. Sudden cardiac arrest, like I say, is a sudden stop of our heart because of the electrical condition. So, the sign of sudden cardiac arrest, if you see a patient, he loss of consciousness.
Suddenly.
Loss of pulse, loss of breathing. So it's very different. For patient with heart attack, he still breathe.
But hard to breathe.
Hard to breathe, short of breath. So he feel chest pain, but he's still alive.
So can we say that a cardiac arrest is a terminal level of the heart attack? Or the heart disease.
It can lead to
it can lead to sudden cardiac arrest.
That's the difference.
But sudden cardiac arrest, the etiology or the cause of sudden cardiac arrest is varies. Not only heart attack, but other conditions can cause a sudden cardiac arrest.
So that brings us to our next question, Doc. What actually causes sudden cardiac arrest?
So for the etiologies or the cause of the sudden cardiac arrest, we can divide according to the age.
Yeah.
Because it's quite different for the young age, young adult with the older age patient. For the older age patients, usually it's caused by coronary artery disease that cause heart attack.
Okay.
Or it has a more advanced heart disease like heart failure, that can cause the sudden cardiac arrest. But for the younger age, a young adult, is
so young
like
people,
you both,
so young people can also feel this kind of disease.
Yeah, can have a sudden cardiac arrest.
Oh, okay.
And what causes that, Doc?
Yeah, so this is important.
Okay.
We can divide it into 3 categories.
Okay.
The first is the cardiac structural abnormality. So is the abnormality of the structure of the heart. It can be the heart is so thick, we call it hypertrophic cardiomyopathy.
Okay.
So in the left side or in the right side. In the right side we call it IRVC. So sorry, it's many
terms,
medical terms.
Okay, so basically it's of people born with it.
It can be genetic cause. And it can be congenital disease. Or it can be anomalies of coronary artery since born.
Oh, okay.
So it can cause the structural abnormality that cause sudden cardiac arrest. The second thing is the electrical cardiac anomaly.
Okay. What is that?
Is inherited electrical disorder. Maybe you heard about Brugada syndrome, long QT syndrome that can lead to a cardiac arrest.
Cardiac arrest.
The third is acquired cardiac abnormality. Like if you have infections, we call it myocarditis, or sometimes you heard about commotion cordis. Commotion cordis is a heavy blood blow in your chest that can cause a
cardiac arrest.
Cardiac arrest.
Wow.
If you have a spot like
so there are 3 types can cause a cardiac arrest for the young people, and so that's the 3 is really pretty close with us, right? I mean, especially for the workout and sports. We didn't wear, right?
Very aware of that.
That's the thing.
Yes, I have experience with that. But anyways, Doc, what can prevent people from having sudden cardiac arrest?
Okay, so the preventions for sudden cardiac arrest, for the older people, or let's say more than 40, 50 years old, you have to have a, of course, healthy lifestyle. You have to decrease your cholesterol level, your blood sugar, your blood hypertension. You need to control that. So you don't have because most of the advanced age have the coronary artery disease, the cause of sudden cardiac arrest. So you need to prevent this before you have a heart attack.
Our eating habits is important.
Yes, of course, is also that you do exercise more regularly. From the young adult, sometimes it's difficult to prevent, but because you look healthy.
You look okay. You look fine.
But there is a clue. A red flags that need to be aware. If you have the family history that have a sudden cardiac arrest, your first relative or second relative, or your siblings that have sudden cardiac arrest, you need to seek medical advice from the doctor. Or you have an unexplained syncope. It may be once, maybe 2. You may seek help for the expert, especially to the cardiologist that subspecialize in the cardiac rhythm.
That's the 2. The first one is our eating habits. exercise regularly. So basically our lifestyle.
Yes.
And then the second one, if we have, like me, I have a history with my dad passed away.
Genetical?
Yeah, I don't know if it's genetical or not because it's.
Oh, if you have history.
It was sudden death, and then the hospital released the cause is heart attack, or I don't know. I didn't follow the information. We just we just accept the fact, and then probably that can be something that I can use to check myself and my siblings as well to see if there is related to the history, right? That's the thing that we can do as a young generation to prevent from the cardiac arrest. So, doctor, if someone feel that symptoms or notice about the symptoms that you mentioned, is there any first aid or treatment that we can do in order to help someone?
Yes, this is the interesting question. Yeah, because if sudden cardiac death, you don't treat it immediately, it can cause death.
Oh,
yeah.
Okay.
So awareness is the key.
Yeah, number one. Yeah.
So if you see somebody suddenly unconscious, we call it out hospital sudden cardiac arrest. Yeah, so you need to help him. Yeah, so American Heart Association say that there is a 14 type of survivals. Yeah, early recognition. Yeah, if you see patient unconscious, you know that you need to help. You check him whether he's really unconscious, he have a pulse or he's still breathing. Yeah, so you call a help.
Yeah.
In Indonesia, maybe you can call ambulance.
Yeah.
Not 911, but 119.
Yeah, 119.
119.
Don't get confused.
Yeah. You can call everybody to help.
Yeah.
Yeah. And the second thing is do the CPR.
CPR. Oh.
Cardiac respiratory, pulmonary resuscitation.
Okay.
So you do a chest. Yeah. Give a chest compression. And sometimes if the people you unknown, you cannot give a breath-to-breath ventilation because it might be viral or something. But at least you give a chest compression. Very fast, about 100 times per minute.
Wow.
Yeah.
100 times.
Okay, 100 times per minute.
And the third thing is the early defibrillation. Early defibrillations mean that usually in the public area, like airport or train station, they have a AED, automatic external defibrillator. So you can apply to patients with cardiac arrest, and the device will automatically recognize what is the rhythm of this patient, and he will advise if you give a shock or not.
It can be used as a recommendations then.
Yeah. It can be done with the lay person with this trained to use this device. So with the early defibrillation, it will increase the survival of the patient with sudden cardiac arrest.
Wow, that we have to learn about this because we never know.
Yes, of course.
Can happen
many training from Indonesia Heart Rhythm or Indonesia Heart Association to train the lay person to do this kind of procedure.
At least we know how to do the chest compression.
Yes,
I really didn't know how to do it. I just saw it in the movie, but I think it's really useful. I think it's really useful, right? But we don't know how to count it and what second or the timing and everything. So basically, since doctor has already told us, I think this is the thing that we have to learn. At least we know how to do it, right?
It's a skill that we need to have, I think.
Because for the first aid or first to help someone who probably
and the last stage, after you do that, the first stage you already called the help. The ambulance come, they will take over for the advanced life support. Take to the hospital, recovery phase, and then do another treatment to save this.
Doctor, you mentioned about the treatment that people can have, especially for the first aid treatment if someone got the symptoms or feel something that lead to a cardiac arrest. How about the tests that we can do as probably young generations or older generations? What kind of tests should we take to get to know if we are I don't know, probably we're bringing something that lead us to the cardiac arrest or related to heart disease?
This is very important question.
This is very important. I'm waiting for this answer, Doc.
We have to do it.
Yeah. For a young adult, like I said before, there is no symptom that precedes for the sudden cardiac. We feel healthy. But like I said, there is a red flags you need to aware if you have a family history that have a sudden cardiac arrest, or you have a unexplained syncope. So you need to check for ECG.
Oh, we have to go to the
see the doctor, go to do a ECG, consult with the cardiologist, and from the ECG, maybe 40–50% we can know there is abnormality that can lead you to
heart disease.
Have a higher probability for the cardiac arrest, like a long QT syndrome, the inherited cardiac electrical disorder, or long QT syndrome. It can be found in the ECG.
Oh, ECG. Okay.
So from the hypertrophic cardiomyopathy also can be found with ECG.
Okay.
So we can do other tests with treadmill, with Holter monitoring to monitor your heartbeat for longer period, maybe 1 day to 7 days. So we also can do an MRI if you have a hypertrophic cardiomyopathy. We can see the thickness of the wall, and then that helps to prevent the sudden cardiac arrest. So for the older people, of course, you need to check regularly.
Yes,
especially if you have a high risk.
So folks at home, this is not to scare you. This is actually to help us know our body better.
True.
And
so we can be aware.
So we can be aware on what to do next.
Exactly.
Totally.
Last but not least, any thing that you want to say to our viewers at home? Any tips or any advices for them to have a healthier lifestyle, maybe? So
especially about the exercise. Sometimes
so
we don't know. Sometimes we do over-workout that leads to cardiac arrest or something. That's very important.
Any tips?
So I must highlight it that even though we know that sudden cardiac arrest is devastating, but it is preventable.
Oh, okay.
Yes. So for the young people, the healthy people,
claim themselves as a healthy
people. When you do a exercise, or you need to check first, especially for the athlete with the endurance sport or extreme sport, like a marathon, basketball player, football, soccer. They need.
Are you talking about me, doctor?
I was about to say that.
I'm not targeting you,
I am going to the doctor.
But thank God
we'll
that
talk,
you realize. All right.
At least you have a ECG. You have to treadmill test. Something that to eliminate that electrical inherited disorder like that. For the older people, of course, healthy lifestyle is needed. Eat healthily, less sugar, less salt, and less cholesterol.
More sleep.
More sleep. Don't stress a lot. Don't work, overwork.
Don't overwork. Don't stress.
All right.
Don't
Also about
enjoy
the
life.
test, about the test, doc. How long, or is there any like minimum times that we can do tests regularly?
Every 6 months, every year.
Every year.
For the athlete, they will have a test initially.
Because they have a program, right?
For the young adults, if you have a clue the red flags that I told you before, you need to have a test. So for the older age, maybe after 40 years old, if you have a risk factor, you need to have a test. And yearly, you need to continue test if you have a high risk.
We have to check our body.
Yes, of course.
This is
all right.
Wow. Well, doctor, thank you very much.
Thank you so much, doctor.
You're welcome.
Thank you so much for coming and to give us a lot of information about the cardiac arrest. Now, at least now we know better that cardiac arrest is different with heart attack and it's preventable alhamdulillah. So we can check to our body, to check to, especially to our loved ones.
Yes,
sometimes we care about our body, but sometimes we don't care about others.
Ooh,
right? So I think
right.
that's really important to check regularly, mindful with
what we intake
our
for
lifestyle, eating habit, exercise, don't
Sleep.
overwork, sleep well,
Don't overwork.
live well as well, too, right?
Don't stress out.
Okay.
Enjoy life. And also get health insurance. It's important. Okay, doctor, thank you very much. It is really insightful and really inspiring. It's really eye-opening.
Okay,
I
thank
guess
you.
to a lot of our viewers at home as well. So yeah, that is our talk with Dr. Beny, and we'll have more interesting stories from around the world after the break. So stay here on the C Morning Show, only on C Today.